morning, everyone. We are from BSN 202 and we will be your facilitators for today's discussion, which is the drugs affecting the cardiovascular system. And for today, we will be your lecturer from the slide presented by Ma'am Joyce Asena, and expect that from time to time, we will be using video clips, terms from the web in order to internalize and understand the topic more easily. So, the cardiovascular system, also called the circulatory system, is the transportation system of the body. The major structures that makes this possible are the heart, blood vessels, and blood. So, the heart pumps the blood in order to move nutrients through the blood vessels to nourish and remove the metabolic wastes from the body. The purpose of this video is to first present a basic understanding of the cardiovascular system. Second, a more in-depth of the study which will be presented, where we will look into the parts and function of the cardiovascular system. The third is we will present the diseases of the cardiovascular system. And lastly, the drugs affecting the cardiovascular system. Before I discuss to you the main topic, I will now first give you a little bit background about the circulatory system for you to better understand more the system. So, the heart has two major circuits within the circulatory pathway which work together in a closed circulatory system. These two pathways are also known as the pulmonary pathway and the systemic pathway. In the human organism, the right side of the heart pushes the blood through the pulmonary circuit so that it can be oxygenated in the lungs, while the left side of the heart pumps oxygenated blood to the entire body. The blood is then returned to the heart via systemic pathway, where the cycles begin again through the pulmonary pathway. So now let's proceed to the main discussion. As you can see on the presentation presented, the pericardium seen here is a double-walled sac that encloses the heart, the pericardial fluid, and the roots of the great vessels, and is situated within the middle mediastinum. So the pericardium has one layer made up of fibrous tissues and one made up of serous tissues. So its function is to lubricate the moving surfaces of the heart. The pericardial sac also attaches via ligamentous fibers to the sternum, and due to these attachments, it is affected by the movements of the heart, the great vessels, the sternum, and the diaphragm. So now, let's proceed to the aorta and its branches. So the aorta is the largest artery in the body, which begins at the top of the left ventricle. As we all know that the heart has two integrals, which is the right ventricle and left ventricle. But the aorta begins at the left ventricle. It's actually a tube about foot long and inch in diameter. Now, let's divide the aorta into four parts: the ascending, the arc of the aorta, and the descending aorta. And the descending aorta is further divided into two parts, which is the thoracic aorta and the abdominal aorta. Now, the ascending aorta is about 5 cm long and actually begins at the base of the left ventricle within the fibrous pericardium and divided into two projects: the coronary artery and the left coronary artery. So the right and left coronary artery is actually supplies the blood to the heart and are considering the muscles of the heart. As you can see on the picture presented, these are the parts of the heart. So the parts of the heart includes the superior vena cava, Branches of right pulmonary artery, right pulmonary veins, right atrium, coronary sulcus, right coronary artery, right ventricle, inferior vena cava, aortic arch, left pulmonary artery, branches of left pulmonary artery, pulmonary trunk, left pulmonary veins, left atrium, great cardiac vein, anterior intraventricular artery, and the left ventricle. I am going to show you a video clip discussing the blood flow through the heart. So, let's start watching the video.
Veins are blood vessels containing blood flowing to the heart, while arteries have blood flowing from the heart. The blue is representative of blood vessels containing deoxygenated blood, while the red blood vessels have oxygenated blood fresh from the lungs. Now, let's follow the path of the blood through the heart. The superior vena cava receives blood from the head, neck, upper limbs, and chest. Meanwhile, the inferior vena cava receives blood from the trunk, viscera, and lower limbs. Both the superior and inferior vena cava end up in the right atrium, one of the 4 chambers of the heart. The heart not only has 4 chambers, it also has 4 valves. The purpose of the valves is to keep blood moving in the right direction and not flow backwards. Blood exits the right atrium through the tricuspid valve, so called because it has 3 flaps, and enters the right ventricle. The blood exits the right ventricle through the pulmonary valve and enters the pulmonary artery. Again, it is an artery because blood is flowing away from the heart, but it is blue because it lacks oxygen. The pulmonary artery then splits into the left and right pulmonary arteries, which go to each respective lung. In the lungs, gas exchange occurs. The blood discards carbon dioxide and picks up oxygen. Now, blood comes back from the lungs through the pulmonary veins, entering the left atrium. Next, the blood is pumped into the left ventricle through the mitral or bicuspid valve. Finally, the oxygenated blood leaves the left ventricle through the aortic semilunar valve, entering the aortic arch. The aorta, which is the largest of all the arteries, distributes the oxygenated blood to the rest of the body. The aortic arch has 3 major branches, which supply the head and arms with blood. Then the aorta curls downward behind the heart, forming the descending aorta, which descends through the chest and continues down through the abdomen. In the abdomen, the descending aorta splits to supply the pelvis and legs with blood.
If you like this video...
So now let's proceed to the cardiac conduction system. So the cardiac conduction system is a group of specialized cardiac muscles in the walls of the heart that send signals to the heart muscle, causing it to contract. The main components of the cardiac conduction system are the SA nodes, AV node, bundle of His, bundle branches, and Purkinje fibers. So the SA nodes, which are the anatomical pacemakers, starts the sequence by causing the atrial muscles to contract. From there, the signal travels to the AV node through the bundle of His, down to the bundle branches, and through the Purkinje fibers, causing the ventricle to contract. The signal creates an electrical current that can be seen on a graph called electrocardiogram or the ECG. So the doctor uses an ECG to monitor the cardiac conduction system's electrical activity in the heart.
So hello there guys, I am here to present about the functions of the heart. First, there are 4 chambers of heart, the right and left atrium and the right and left ventricle. So the first one, the right atrium receives blood from the veins and pumps it to the right ventricle. Next is the right ventricle receives blood from the right atrium and pumps it to the lungs, where it is loaded with oxygen. Then the left atrium receives oxygenated blood from the lungs and pumps it to the left ventricle. The left ventricle, which is the strongest chamber, pumps oxygen-rich blood to the rest of the body. The left ventricle's vigorous contractions create our blood pressure. So next is still part of the functions of the heart. First is the automaticity, which conducts electrical impulses. Second, the irritability, which automatically beats even without stimulus. Third, conductivity, the ability to conduct impulse to the next cell. And the contractility, which contracts and relaxes the atria and ventricles, or called depolarization and repolarization. Next is next function of the heart. It responds to the autonomic nervous system, which when stimulus is present. Next, it pumps oxygenated blood in the body, and it follows a normal rhythm of heartbeat to make sure the heart contracts and relaxes adequately. And lastly, it supplies its own blood through the coronary arteries. And that's all for the functions of the heart.
Hi, I'm Crystal Tapang. Now, I'm going to discuss about the diseases of cardiovascular system. So, in this video, we are allowing Sir Vicente Bailon to use this video for academic purposes only. So, before I start, do you guys recall in your anatomy and physiology as to what are the known diseases of cardiovascular system or the heart that you remember or that you recall? Okay, so the first disease is the most common disease of the heart, which is the hypertension and hypotension. So what is hypertension? It is also known as high blood pressure. It is a long-term medical condition in which the blood pressure in the arteries is persistently elevated, and this does not cause any symptoms. So what determines our blood pressure? It is both the amount of blood our heart pumps and the amount of resistance to blood flow in your arteries. So the more blood your heart pumps and the narrower our arteries, the higher your blood pressure. There are two types of hypertension. First is the primary and the second is the secondary. So in primary, ito yung kapag nag-occur sa'yo ang high blood pressure, pwede mo pa siyang ma-prevent through your lifestyle. So babaguhin mo yung lifestyle mo, kakain ka ng masusustansyang pagkain, especially vegetables and foods na rich in protein. Itong secondary is yun yung kapag nag-attack ulit, so nagkaroon ka ulit ng high blood pressure. So magkakaroon ka na niyan dyan ng maintenance, and usually may iba pa ring mga problems aside from nagkakaroon ka ng high blood pressure. So it means na meron ka pang ibang problems in your internal body systems. And since nagme-maintenance ka na, kailangan mo din siyang sabayan ng pagkakaroon or pagkakain ng healthy foods and vegetables, yung kumain ka din ng fruits, and mag-vitamins. Another one is hypotension. So what is hypotension? It means low blood pressure. Usually kasi yung BP natin is 90/60. Sinasabi nilang mababa na yon, pero it varies sa age ng tao. And yung symptoms ng hypotension, it includes dizziness, fainting, o yung madalas na pagkakaroon mo ng walang malay at madalas na pagkahilo, blur vision, kasama din yon, nausea, fatigue, and lack of concentration. May mga nagkukos ng low blood pressure. First is pregnancy, heart problem, dehydration, blood loss, and also severe infection and allergic reaction, and lastly is yung lack of nutrients. So the treatment for this is you need to eat healthy foods, vegetables, and fruits, especially rich in protein. Tapos avoid mo yung masyadong matatamis na pagkain and yung salty foods, and mag-maintain ka ng healthy weight, and mag-engage ka sa mga physical activities such as yung exercise, and i-limit mo or avoid mo na uminom ng alcohol, and hindi ka din mag-smoke, Kasi isa yung mga risk factor na para magkaroon ka ng hypertension and hypotension. And also, i-manage mo yung stress. Kasi pag nasa-stress tayo, it can cause our pressure to get high. And also, imo-monitor natin ang BP natin. And wag natin kalimutan na laging magpa-check up. Next, congestive heart failure, cardiomegaly, and cardiomyopathy. So, what is congestive heart failure or CHF? A chronic progressive condition that affects the pumping power of our heart muscles, and it specifically refers to the stage in which fluid builds up around the heart and causes it to pump inefficiently. So, ano yung mga symptoms ng congestive heart failure? First symptoms is shortness of breath or tinatawag nating dyspnea, fatigue or weakness or nanghihina, meron ding swelling or edema, and rapid or irregular heartbeat, and lastly, reduced ability to exercise. Yun yung hindi ka na nakaka-engage ng mga activities na yun katulad ng exercise. So, next is cardiomegaly, which means the heart is enlarged, or it is also called the enlargement of the heart. So, itong cardiomegaly ay minsan nangyayari to inborn, pagkabuhay pa lang. And kasi minsan namamana to sa mga mama or father natin, mother and father. So, pero kasi itong cardiomegaly, hindi naman siya disease, pero sign siya ng another condition or problem. And next is cardiomyopathy. So, cardiomyopathy is a disease of heart muscle that makes it harder for our heart to pump blood to the rest of our body. So, yun yung nahihirapan ng mag-pump yung blood natin na umabot sa buong katawan natin. And next naman, it can lead also to another heart failure. So, another disease is cardiac arrhythmia, or it is also called cardiac dysrhythmia. This means irregular heartbeat. It is the too fast and too slow. Too fast, it is also called tachycardia, which is our blood pressure is more than 100, and the too slow is also called bradycardia, and yung beats per minute niya is 60 or lower. Ang symptoms ng cardiac arrhythmia ay palpitation and dizziness. Pero sa cardiac arrhythmia, hindi lahat ng factors ay nakaka-affect. Katulad na lamang ng pag-exercise. 'Di ba kapag nag-exercise tayo, nag-i-increase yung blood pressure natin. So nagiging mas mabilis yung heartbeat natin. So hindi yun kasali sa risk factors ng cardiac arrhythmia. Next disease is coronary artery disease. It is narrowing or blockage of the coronary arteries and usually caused by atherosclerosis, which means hardening or clogging. It is buildup of cholesterols or fat on the inner walls of the arteries. Under this is angina pectoris, hyperlipidemia, or also called hypercholesterolemia. So what is angina pectoris? It is also called chest pain or discomfort due to coronary heart disease. So, when the heart muscle doesn't get as much blood as it needs, nangyayari to kapag merong may naka-block or may nakabara sa heart arteries natin. So, nagnanarrowed at tinatawag yun na ischemia. Another is hyperlipidemia or hypercholesterolemia. So, from the word lipid, it means yung blood has too many lipids or fats such as cholesterol and triglycerides. So, this condition increases fatty deposits in arteries and the risk of blockage. So, itong hyperlipidemia, makikita mo to kapag may kumuha pag nagpakuha tayo ng dugo. May makikita kang lipids sa taas ng dugo natin, tas nasa baba yung blood. So, ano nga ba yung mga foods na rich in cholesterol? So, ito yung cheese, egg yolks, fried and yung processed foods, ice cream, and also yung mga pastries. So, kung maaari nating iwasan yung mas kumain ng mga foods na rich in cholesterol and yung kainin natin is yung mga vegetables and fruits na high in protein and yung mga healthy foods. So next, I will be discussing about drugs affecting the cardiovascular system. These are the antihypertensive drugs, cardiotonic drugs, antiarrhythmic drugs, antianginal drugs, lipid-lowering agents, anticoagulations, and last is the thrombolytic agents. Antihypertensive drugs have their primary action on systemic vascular resistance. And some of these drugs produce vasodilation by interfering with sympathetic adrenergic vascular tone or by blocking the formation of angiotensin or its vascular receptors. Some antihypertensive drugs, most notably beta blockers, depress heart rate and contractility by blocking the influence of sympathetic nerves on the heart. So first, what is beta blockers? According to Mayo Clinic, it is also known as beta-adrenergic blocking agents. Cardiotonic agent. Cardiotonic are drugs that used to increase the efficiency and improve the contraction of the heart muscles, which leads to improve the blood flow to all tissues of the body. Drugs that increase the contractile power of the myocardium and thus enhance its capability and efficacy are called cardiotonic agents. Cardiac insufficiency can be defined as an inability of the heart to pump a sufficient amount of blood to supply oxygen and nutrients to organs and tissues, which leads to fatigue, shortness of breath, and edema. Antiarrhythmic drugs. An arrhythmia is a condition in which the heart beats too quickly, too slowly, or irregularly. In many cases, the arrhythmia may not be serious or require any treatment at all. However, if your doctor finds that arrhythmia could lead to more serious heart problems, they may prescribe medications. Antianginal drugs are those that prevent, abort, or terminate attacks of angina pectoris. So there are types of angina. So first one is atherosclerotic angina or the classic angina. The attacks are predictably provoked by exercise, emotion, eating, or coitus and subside when the increased energy demand is withdrawn. So as you can see, those are the classes of drugs used in the treatment of angina and myocardial infarction. Hypolipidemic agents or antihyperlipidemic agents are a diverse group of pharmaceuticals that are used in the treatment of high levels of fats or lipids, such as cholesterol in the blood or hyperlipidemia. They are called lowering drugs or these drugs which lowers the level of lipids and lipoproteins in the blood. So there are several classes of hypolipidemic drugs that may differ in both on the cholesterol profile and adverse effect. So for example, some may lower the bad cholesterol or low density lipoprotein more so than others, while others may preferentially increase high density lipoprotein or the good cholesterol. Clinically, the choice of an agent depends on the patient's cholesterol profile, cardiovascular risk, liver and the kidney functions of the patient. So it is evaluated against the balancing of risk and benefits of the medications. Anticoagulants. Anticoagulants are medicines that help prevent blood clots. They are given to people at a high risk of getting clots to reduce their chances of developing serious conditions such as strokes and heart attacks. A blood clot is a seal created by the blood to stop bleeding from wounds. While they are useful in stopping bleeding, they can block blood vessels and stop blood flowing to organs such as the brains, hearts, and lungs if they form in the wrong place. Anticoagulants work by interrupting the process involved in the formation of blood clots. They are sometimes called blood thinning medicines, although they don't actually make the blood thinner. They are used for similar purposes. Anticoagulants are different to antiplatelet medicines, such as low-dose aspirin and clopidogrel. So there are types of anticoagulants. The most commonly prescribed is warfarin. Newer types of anticoagulants are also available and are becoming increasingly common, and this includes rivaroxaban or Xarelto, dabigatran or Pradaxa, apixaban o Ilikis,
edoxaban o lixiana. Warfarin and the newer alternatives are taken as tablets or capsules. There is also an anticoagulant called heparin that can be given by injection. Thrombolytic agents. So it is a drug that is able to dissolve a clot or thrombus and reopen an artery or vein. Thrombolytic agents may be used to treat a heart attack, stroke, deep vein thrombosis or clot in a deep leg vein, pulmonary embolism, and occlusion of a peripheral artery or indwelling catheter. All thrombolytic agents are serine proteases, or they digest protein and convert plasminogen to plasmin, which breaks down the fibrinogen rather, and fibrin and dissolves the clot. Currently available thrombolytic agents include retaplase, alteplase, purukinase, anisoylate kinase activator complex, and streptokinase, are also called clotbuster, clot dissolving medication, or fibrinolytic agent.
I am now going to present to you the cardiac action potential. The cardiac action potential is the process linking electrical excitation to contraction. Calcium has an essential role in this process. A raised intracellular calcium concentration is the trigger that activates contraction. An understanding of calcium handling is essential to understanding the function of the heart. The cardiac action potential has 5 phases: the phase 0, phase 1, phase 2, phase 3, and phase 4. On the phase 0, or which is known as depolarization because of the opening of the fast sodium channels, potassium flux also decreases. On the phase 1, or the partial repolarization, because of a rapid decrease in sodium, ion passage as fast sodium channels close. On the phase 2, which is the plateau phase, in which the movement of calcium ions out of the cell maintains depolarization. On the phase 3, or the repolarization, sodium and calcium channels are all closed and membrane potential returns to baseline. On the phase 4, or the resting membrane, resulting from the activity of the sodium and potassium ATPase pump, which creates a negative intracellular potential because of the exchange of the 3 ions for only 2 potassium loss. So now, I will be discussing the QRS complex or the QRS duration. So, the electrocardiogram or the ECG is the common test used to detect the problems in the heart. So, when this electrical impulse passes through your heart, electrical current are created that spreads through your body and reach to the surface of the skin. So, an ECG is performed by placing an electrodes on the skin overlying the heart. As the electrical impulse moves from the atria, which are the top 2 chambers, to the ventricles below, the voltage measurement between the electrodes varies, and this produces a graph of your heart, of how your heart is performing. This provides the person running the test with valuable information based on the intensity of the heart's contraction and the time intervals between those contractions. So, in a normal ECG, there is a distinct waves. Together, these waves represent one heartbeat. So, the first wave is called the P wave. As you can see on the picture presented, it is relatively a small wave. It represents the depolarization of the atria. So the QRS wave is sometimes called the QRS complex, and it represents the depolarization of the ventricles. This quickly leads to the contraction of the ventricles and the ejection of the blood out of the heart and into the large arteries existing the heart. A T wave follows the QRS complex and indicates intraventricular repolarization. Unlike a P wave, a normal T wave is slightly asymmetric. The peak of the wave is a little closer to its end than to its beginning. T waves are normally positive in leads 1, 2, and V2 through V6 and negative in AVR. A T wave will normally follow the same direction as the QRS complex that precede it. When a T wave occurs in the opposite direction of the QRS complex, it generally reflects some sort of cardiac pathology. Next slide, the picture is showing the PR interval, QRS duration or the QRS complex, and the QT interval. So the PR interval is measured from the beginning of the P wave to the beginning of the QRS complex. And the QRS duration represents the time for ventricular depolarization. And lastly is the QT interval. It represents the electrical systole of the ventricles, or the ventricular depolarization and repolarization. It is measured from the beginning of the QRS complex to the end of the T wave.
So for the next presentation is about titrate versus taper. So first, what is taper? So drug tapering is a common technique used in practice to gradually discontinue or reduce a therapeutic dose of a drug over a period of time. Its use is most applicable when preventing adverse withdrawal reactions with the sudden stop of certain medications. It also allows for early detection or return of condition or symptoms being treated. Conversely, the term drug titration refers to an incremental increase in dose to a level that provides desired therapeutic effects. Both tapering and titrating processes are warranted in a variety of clinical scenarios to help increase therapeutic tolerability and overall patient comfort. So specifically, there are four major themes, all of which are potential contributing factors for drug tapering errors were identified after data analysis. So first is the lack of standardized tapering guidelines. Standardized pre-printed order forms for drug tapering prescriptions should be considered in order to encourage complete and accurate communication of information between physician, pharmacist, and patient. So second is the inadequate patient counseling. Providing patients with a tapering schedule tool or personalized calendar or booklet for the reference may be beneficial to clarify confusing and extensive directions of use. This should be done in conjunction with adequate face-to-face counseling education and follow-up. So the third is operational limitations. So it is a helpful feature of the pharmacy. Order entry queue would be an extended labeling function, where directions longer than the standard spacing restrictions would automatically populate into this new interference. So the benefit of this feature is that it only allows prescriptions to be filled in a sequential order, that is, prescription in the middle of the chain cannot be selected or to be filled. So for the last is the complexity of prescription. Independent double checks should be performed for each prescription during the order entry and dispensing process. More specifically, rules and policies in the pharmacy should be implemented to increase awareness and conscientiousness during the prescription preparation process. So, drug tapering can be a very long and arduous process fraught with confusion, miscommunication, and medication errors involving all levels of patient care that encompass roles led by physicians, pharmacists, nurses, caregivers, and patients alike. For example, calculations should be documented by both the order entry staff as well as the independent double checker to enhance accuracy.